that sudden sharp pain shooting through your leg, that rock solid knot in your calf that wakes you up yelling.
Oh, yeah.
If you're over 50, you probably know exactly what I'm talking about. It just hits out of nowhere and suddenly, bam, you're on the sidelines.
It really does throw a wrench in things. 1 minute you're fast asleep, the next you're wide awake trying to walk it off. And as we age, those leg issues, the cramps, the feeling of weakness, maybe not feeling quite as steady on your feet, they can make you hesitate.
Yeah, hesitate about doing the things you actually enjoy.
Exactly.
And we often just think, well, that's just getting older. But what if maybe some simple vitamin tweaks could make a real difference?
That's a great question.
That's what we're digging into today. We've looked at a bunch of information, sources like Health Today, Health Wellness Pharmacist, Health 365, Forever Healthy, and Senior Health on YouTube.
Right.
And they all seem to point to key vitamins that can help keep your legs strong and hopefully ward off those frustrating cramps as we age.
Our goal here is really to pull out the most useful, science-backed information about these important nutrients. We want you to have the knowledge to keep your legs feeling strong and reliable so you can confidently say yes to whatever comes your way.
And you can trust that what we're about to discuss is based on solid research, expert understanding. We're aiming to give you the straight facts, no bias.
Absolutely.
Okay, let's dive in. First up, a really, really important one. Vitamin D.
Vitamin D. It's so vital, and its role goes way beyond just, our bones. People often think bones, but it's absolutely key for how our muscles work.
How so?
Think of it as the main regulator for calcium in your body. It helps your body absorb calcium, yes, but also make sure it gets where it needs to go within your muscles.
Right, because calcium is like the spark plug, isn't it? The switch that flips to make your muscles contract.
Precisely. No calcium available right there in the muscle cell. No movement.
Got it.
And when you don't have enough vitamin D, well, your muscles can't manage that calcium properly. This can actually make your muscles slow to relax after they tighten up.
Oh, interesting. So it's not just the contraction, it's the letting go.
Exactly. That lack of smooth relaxation is a big reason why those painful cramps happen in the first place. That stiffness, that sluggish feeling.
So vitamin D helps the muscles use calcium correctly, not just absorb it from food. Now, here's where it gets really interesting for me. It also plays a role in building the muscle fibers themselves.
Yes, and in something called neuromuscular coordination.
Okay, break that down.
It's basically how clearly your brain and your leg muscles communicate, how well the nerve signals reach the muscles.
Right.
When you have good vitamin D levels, those messages travel quickly, efficiently. Your legs move smoothly, react when they should. But when D is low, that communication gets a bit garbled,
like static on the line.
Kind of. The signals to your muscles can get delayed, movements might feel slow, and boom, those sudden cramps can strike, often at night when you're trying to sleep.
And it's not just the dramatic cramps, is it? Low D can make your legs feel weak, heavy, tight, even like they're twitching sometimes, even if you're trying to stay active. Yeah.
Plus, and this is a big one, it makes you more likely to fall.
Which is a serious concern.
Huge. And some information even suggests low D can be linked to that deep fatigue, achy muscles, sore joints, especially, interestingly, in the lower back.
Wow. Okay. And what's fascinating here is how easily a deficiency can happen, right? Especially as we get older.
It really can. Our skin's ability to make vitamin D from sunlight actually decreases. There was a 2020 study suggesting it drops by roughly, 13% every decade after a certain age?
13% per decade. So even if you are getting some sun, it might not be doing as much good as it used to.
Exactly. And let's be honest, many of us spend more time indoors as we age.
Or we're more covered up when we go out. Sunscreen, clothes.
Right. Glass windows block the useful UVB rays. Clothing does too. Even the time of day matters. And sunscreen, while absolutely vital for skin cancer prevention, it does reduce vitamin D production significantly.
Okay, so what can you do about it? There must be solutions.
Oh, absolutely. Good news is there are ways to boost levels. Sunlight is still a great natural source if you can manage it safely.
How much?
Try for maybe 15 to 30 minutes of direct sunlight on bare skin. Think arms and legs without sunscreen, preferably late morning or early afternoon when UVB is present, but maybe not peak intensity.
And food. I know some foods have it.
Food can help, but yeah, often it's tough to get enough just from diet alone. Fatty fish like salmon, mackerel, those are good sources. About, say, 4 ounces of salmon gets you a decent chunk.
Okay.
Fortified milk, egg yolks, they have some, but you need a lot. A large egg yolk only has around 44 IU.
And the recommendations are much higher, aren't they?
Often in the hundreds, or even over 1,000 IU per day for older adults.
Oh,
and some mushrooms exposed to sunlight have a bit too, but it varies.
So supplements often come into play.
Very often, especially for adults over 65. Vitamin D3, that's cholecalciferol, seems to be the form your body absorbs best.
And dosage.
A common suggestion is 800 to 1,000 IU per day. And definitely take it with a meal that contains some healthy fat.
Why fat?
Because vitamin D is fat soluble. It needs fat to be properly absorbed. Think eggs, avocado, nuts, olive oil.
Got it. And if levels are really low,
Then your doctor might recommend a higher dose. It's always a good idea to get your levels checked with a simple blood test first.
Now, here's a really practical tip we came across. We're calling it the sunlight squat.
Oh, I like the sound of that.
Yeah. Start your morning, maybe open a window, or even better, step outside if you can. Do, say, 5 to 10 slow chair squats using a sturdy chair for support, of course.
Okay, gentle movement.
Then take maybe a 10-minute walk with your arms and legs uncovered, weather permitting.
Combining the sunlight exposure with some light activity. That's clever. Helps the body make and use the D.
Makes it a habit, right?
Great idea. Just a couple of cautions to keep in mind.
Go ahead.
Don't go overboard with supplements. Generally, don't exceed 4,000 IU per day unless your doctor specifically tells you to. High doses can cause calcium buildup problems.
Okay.
And if you have any kidney or liver issues, definitely talk to your doctor before starting or increasing vitamin D.
Right. And remember, the fat part, don't take it on an empty stomach.
And just walking around inside near a window or being outside fully clothed with sunscreen, that won't give you the same D benefit from the sun.
Okay, so the big takeaway here, vitamin D isn't just for bones. It's absolutely vital for muscle strength, coordination, and helping prevent those awful leg cramps and falls.
Couldn't have said it better.
All right, let's shift gears. Another really crucial vitamin for leg health, B12.
Yes, vitamin B12. It plays a super important role kind of in two key ways for keeping legs strong and steady.
Okay, what's the first way?
Well, first, on a really fundamental level, it helps make the myelin sheath.
Myelin sheath, that's the insulation around nerves, right?
Exactly. Like the coating on an electrical wire. It allows those nerve signals to travel quickly and accurately. When you have enough B12, the messages from your brain zip down to your leg muscles without delays. Smooth, confident movement.
And what happens if B12 levels are low? What's the impact?
Well, that myelin sheath can start to fray, essentially. Causes the nerves to misfire.
Misfire, how does that feel?
It can show up as slow reactions, legs that feel hesitant or clumsy, problems with your balance, that sensation of heavy, tired legs. It's not necessarily that you are clumsy, it's that the communication system isn't working optimally.
Okay, that makes sense. You mentioned a second way B12 helps.
Yes. B12 is really important for making red blood cells.
Ah, the oxygen carriers.
Precisely. These cells carry oxygen all through your body, including down to your leg muscles.
Yeah.
If you don't have enough B12, your body can't make enough healthy red blood cells. Meaning your muscles don't get the oxygen they need to function well. They'll tire out much more quickly. You might find yourself feeling short of breath after just a little bit of activity.
That explains a lot. I've heard people talk about tingling or numbness in their feet. Is that connected to B12?
Absolutely. That pins and needles feeling, numbness that makes it hard to feel the ground properly, a subtle sense of unsteadiness, all potential signs that B12 levels might be low.
And the symptoms aren't just in the legs, are they?
No, not at all. Feeling constantly fatigued, having trouble with memory, brain fog, shortness of breath, looking unusually pale, even having a sore red tongue. These can all be quiet clues that your B12 is low. Irritability or low mood too, sometimes.
And why is it that older adults seem more likely to be low in B12? Is it just diet?
Diet can be a factor, especially for vegetarians or vegans, but it's often more about absorption. As we age, our bodies just become less efficient at absorbing B12 from food.
How come?
Lower production of stomach acid is a big one. You need enough acid to release B12 from food proteins. Also, certain medications can interfere.
Like which ones?
Things that reduce stomach acid, proton pump inhibitors, H2 blockers, reflux medications, and even metformin, which is commonly used for diabetes. You also need something called intrinsic factor, a protein made in the stomach, to absorb B12 properly.
Okay, so absorption is key. What's the recommended amount we should be getting? And how much do we actually absorb?
Well, the official recommended daily intake, the RDA, for adults over 50 is 2.4 micrograms. That sounds tiny.
It does.
But because of those absorption issues we just talked about, many doctors will actually recommend a much higher daily dose from supplements often somewhere between 500 and 1,000 micrograms.
Wow, that's a huge difference. Why so high?
Because your body only absorbs a really small percentage of even those higher supplement doses, maybe around 2% from a 500 microgram pill and maybe 1.3% from a 1,000 microgram one.
So you need a lot more going in to get enough absorbed.
Exactly. And for people with really severe absorption problems, sometimes B12 injections are the only effective way.
What about getting B12 from food? Can we manage that?
You can get it from animal-based foods, but it's only in really significant amounts in a few specific things. Liver is a powerhouse. A small serving of beef liver has a ton.
Right, but not everyone's eating liver regularly.
Exactly. Clams and oysters also have quite a lot. But again, maybe not everyday foods. An egg has about half a microgram. A cup of milk has around 1.3 micrograms, maybe half the daily value.
So relying solely on eggs and milk might not cut it, especially with absorption issues.
Probably not for many older adults. And if you follow a strict plant-based or vegan diet, B12 isn't naturally present in plant foods at all. So fortified foods or supplements become pretty much essential.
You mentioned a simple exercise earlier related to B12. What was that?
Ah, yes, the knee lift tap stand. It's easy. After you take your B12, maybe stand near a chair or countertop for a bit of balance support.
Okay.
Gently lift one knee up towards your chest and try to tap your palm with it. Then lower it. Repeat with the other leg, maybe 10 times each side.
What does that do?
It helps activate your proprioception, that's your body's sense of where its limbs are in space, and it gently engages those nerves and muscles that B12 supports. It's super low impact. You could do it while the kettle boils.
Great tip. What about safety with B12 supplements? Any concerns there?
Generally, B12 is very safe. It's a water-soluble vitamin,
Meaning
any extra that your body doesn't need usually just gets flushed out in your urine. So high doses are generally considered safe. Taking mega doses won't suddenly make you stronger, though.
no magic bullet.
No. But, as always, if you have specific health conditions like kidney disease or certain blood disorders, it's best to check with your doctor before starting any supplement.
Got it. So the key takeaway for B12, absolutely crucial for healthy nerves and for oxygen delivery to muscles, directly impacts leg strength, balance, and helps prevent that awful numbness and tingling.
Spot on. Now, shall we move to vitamin B6?
Let's do it. Vitamin B6, how does this one fit into the leg health picture?
Vitamin B6 is a bit of a behind-the-scenes player, you could say. It's involved in over 140 different enzyme processes in your body. So it does a lot.
Okay.
And while it might not be the first vitamin you think of specifically for leg cramps,
Right, I haven't heard that connection as much.
no. And it's worth noting that current research hasn't really found a direct link showing that taking B6 supplements prevents leg cramps specifically. But it definitely plays an important role in overall leg health, which can indirectly be helpful.
Okay, so how does it contribute indirectly?
Primarily through its role in making neurotransmitters.
The chemical messengers again?
Exactly. The signals flying between your brain and your legs. When B6 levels are adequate, those signals are clearer. Also, B6 helps your body build hemoglobin.
Hemoglobin, oxygen carrier in red blood cells like B12.
A similar role, yes. So if you don't have enough B6, your muscles might not be getting all the oxygen they need.
And what are some signs if you're low in B6? How might that feel in your legs?
Well, with weakened nerve signals and potentially reduced oxygen supply, you might notice your thighs feeling unusually tired, even after very little activity.
Like climbing one flight of stairs feels like a marathon.
Kind of, yeah. Or maybe a burning sensation in your legs after just mild exertion. Beyond the legs, low B6 can also manifest as irritability, forgetfulness, feeling kind of foggy-headed,
Brain fog, yeah.
patchy sleep, even physical things like cracked lips, sores in your mouth or on your tongue, or skin problems.
Okay, what's the recommended daily amount for B6?
For adults over 50, it's around 1.5 milligrams per day for women and about 1.7 milligrams per day for men.
And absorption, does that decrease with age too?
It can, yes. And certain medications can interfere with B6 as well. Things like hydrolysine, which is for high blood pressure, and isoniazid, used for TB.
So should older adults consider a B6 supplement?
It's possible many could benefit from a small daily supplement, maybe in the range of 6 to 10 milligrams.
Any tips for taking it?
It's generally a good idea to avoid drinking alcohol around the same time you take it, as alcohol can hinder B6 absorption. And just good practice overall. Try to limit sugary foods, saturated fats, and high sodium stuff that can impact nutrient use generally.
Makes sense. What about good food sources of B6?
Salmon is a good one. A 3-ounce serving has about 0.6 milligrams. Beef liver and tuna are also excellent sources, providing a big chunk of your daily value.
Okay.
Cooked chickpeas are great. A cup has about 1.1 milligrams. Bananas, boiled potatoes have some too. Chicken, turkey, fortified breakfast cereals also contribute.
Anything help with absorption from food?
Interestingly, B6 seems to be absorbed better when you eat it with protein. So having it with, say, a boiled egg or some oatmeal might be beneficial.
Now, is there a risk of getting too much B6? Any safety concerns?
Yes, that's a really important point to make. It's a common myth that if a little is good, more must be better. Not true for B6.
Why not?
Taking very high doses, we're talking over 100 milligrams per day, especially long term, can actually cause nerve damage, peripheral neuropathy.
Oh, wow. What does that feel like?
Problems with coordination, numbness, changes in sensation.
Yeah.
So definitely stick within the safe recommended ranges unless your doctor specifically advises a higher dose for a particular reason.
Right. So the key takeaway for B6, it's a supporter. Supports nerve health, helps oxygen delivery, contributes to overall leg strength and preventing fatigue, even if it's not the number one go-to for stopping cramps directly.
Exactly. It's part of the bigger picture for healthy legs. Now, shall we talk vitamin E?
Let's do it. Vitamin E. I know this one as an antioxidant.
That's its main claim to fame. Absolutely. It's a powerful, fat-soluble antioxidant.
And how does that help our legs?
Well, it works by protecting your cells, including the nerve cells and muscle cells in your legs, from damage caused by unstable molecules, something called oxidative stress.
Okay, protection. Anything else?
Yes. It also helps keep your blood vessels nice and smooth on the inside. This helps prevent blood cells from clumping together and ensures good blood flow, which means good oxygen delivery. Plus, it seems to have a role in helping blood vessels relax.
I feel like I remember reading something ages ago, an older study maybe, suggesting vitamin E might help with leg cramps.
You're right. There was a study back in 1969 that did suggest potential benefits for leg cramp.
Okay.
But more recent and thorough reviews of the scientific literature haven't consistently confirmed a direct link between taking vitamin E supplements and preventing leg cramps.
So the evidence isn't super strong for that specific use anymore.
Not as strong as initially thought for direct cramp prevention via supplements. However, because of its antioxidant effects and its benefits for circulation, vitamin E definitely still plays a valuable supportive role in overall leg health.
Okay, so what might happen in our legs if vitamin E levels are low?
Well, your nerves could become more vulnerable to damage, potentially affecting that brain-leg communication we talked about. And reduced blood flow, if the vessels aren't as healthy or relaxed, could lead to feeling more fatigue in your legs and might even contribute to cramping indirectly that way.
What's the recommended amount of vitamin E for older adults?
For most adults over 50, the target is about 15 milligrams per day. Sometimes you'll see it listed in international units or IU, which would be about 22.4 IU.
And can deficiency happen easily?
It's possible, especially as we age. If someone's not eating enough healthy fats, that could be a factor, or if they have certain health conditions that affect fat absorption.
What are some good food sources we can look for?
Sunflower seeds and sunflower oil are great sources. An ounce of the oil has around 7.4 milligrams. Almonds are another winner, about 6.8 milligrams per ounce.
Okay, nuts and seeds.
Spinach has some, maybe 2 milligrams in a cooked cup. Wheat germ oil is incredibly rich. Just 1 tablespoon packs a huge punch, over 20 milligrams.
Wow. Should people consider a vitamin E supplement then?
Many people over 50 do choose to take one. If you do, look for the natural form, which is usually listed as D-alpha-tocopherol.
D-alpha-tocopherol, got it. Typical dose.
Often somewhere between 100 and 200 IU daily. And remember, like vitamin D.
Take it with fat.
Exactly. Take it with a meal containing some healthy fat, eggs, nuts, olive oil, to help your body absorb it properly.
Are there cautions with vitamin E too, like B6?
Yes. Taking very high doses, generally considered more than 1,000 IU per day, could potentially thin your blood.
Oh, okay. So careful if you're on blood thinners already.
Definitely. It could also cause dizziness in some people at high doses. So as always, talk to your doctor, especially if you're on anticoagulants.
You mentioned some grocery tips earlier related to vitamin E.
Yeah, just practical things. Look for cold-pressed oils like sunflower and olive, as they tend to retain more vitamin E.
Good tip.
If you eat fish, sometimes frozen wild salmon holds its nutrients better than fresh farmed fish that's been sitting out. For eggs, sometimes deeper orange yolks indicate more antioxidants. Be mindful if you're cutting way back on oils, nuts, fats. You might be reducing your E intake without realizing it.
Check expiration dates too.
Always. Nutrients degrade over time, especially vitamin E in oils and things like milk. Store oils in a cool, dark place. And just generally include some healthy fats with meals to help absorb E and other fat-soluble vitamins.
Okay, so the key takeaway for vitamin E, it's an antioxidant protector, supporting nerve and blood vessel health in the legs. Might not directly zap cramps, according to latest reviews, but helps overall leg health and fights fatigue.
You got it. It's another piece of the puzzle.
So far, we've covered the big four, D, B12, B6, and E, but some of the sources we looked at mention other important vitamins and minerals too. Maybe we can do a quick rundown of those.
Absolutely. Good idea. Potassium came up quite a bit.
Right? Bananas.
Bananas, yes.
Yeah.
But also sweet potatoes, spinach, avocado. Potassium is really important for how muscles function, particularly with fluid balance inside the cells.
And low potassium links too.
Muscle pain, cramps, especially those nasty nighttime ones, stiffness, wobbly legs, and an increased risk of falls. It's also beneficial for bone health.
Okay. And calcium, we touched on it with vitamin D.
Yep. Vital for bone strength, obviously, but also absolutely crucial for muscle contraction. If you don't have enough calcium available, it can lead to weak muscles, cramps, balance issues, and a higher risk of fractures if your bones are weak too.
Sources?
Dairy, leafy greens like kale and collards, almonds, fortified foods like some orange juices or cereals. And remember, vitamin D is calcium's partner. It helps you absorb it.
Important not to overdo calcium supplements though, right?
Very important. Excessive calcium supplementation can potentially lead to issues like buildup in arteries or kidney stones. And doing weight-bearing exercise helps your body use the calcium you consume effectively, putting it into your bones.
Good point. Magnesium was another one mentioned frequently.
Magnesium. Essential for muscle relaxation, the counterbalance to calcium's contraction role. Also vital for nerve health and energy production.
So deficiency could cause cramps.
Definitely linked to heavy legs, fatigue, cramps, including things like restless leg syndrome and those nighttime leg cramps we hate. Also linked to poor sleep.
Where do we find magnesium?
Leafy green vegetables again, nuts, seeds, whole grains. Some people also find Epsom salt baths helpful, as magnesium can be absorbed through the skin to some extent.
Interesting. What about vitamin K, specifically K2?
Vitamin K, especially K2, plays a really interesting role. It helps direct calcium to your bones and away from your arteries. So it's important for both bone health and cardiovascular health, preventing that harmful buildup.
Where do we get K2?
It's found in fermented foods like sauerkraut, natto, certain cheeses, and also in things like ghee and butter from grass-fed cows.
Okay. And one more, vitamin C. How does that relate to legs?
Vitamin C is crucial for joint health because your body needs it to make collagen.
Collagen, the building block for
tendons, ligaments, cartilage, all the connective tissues in and around your joints. It's also a powerful antioxidant and can help your body recover after physical activity.
Sources are pretty well known, right?
Yeah, citrus fruits are famous for it, berries, bell peppers too. Acerola cherry powder is a very concentrated source if you're looking for a boost. Even a squeeze of lemon juice helps.
That's a really helpful overview of the supporting cast. So, looking at all this information, D, the Bs, E, these minerals, what are the main things we should take away?
Well, I think the first big takeaway is that leg problems as we get older often have many contributing factors. It's rarely just one thing. But nutrition, what we eat, the vitamins and minerals we get, plays a really significant role.
So don't just blame age. Look at nutrition.
Exactly. And the focus should ideally be on getting these key nutrients primarily from your diet. Eating a balanced diet, rich in whole, unprocessed foods, is always the best foundation.
But what if diet alone isn't quite cutting it? Maybe due to those absorption issues or dietary restrictions?
Then yes, supplementation might be something to consider, especially for vitamin D and vitamin B12, as we discussed how common deficiencies are there.
But not just randomly grabbing bottles off the shelf.
Please don't. It's really, really important to talk to your doctor or maybe a registered dietitian. Get personalized advice. They can help you figure out if you need supplements, which ones, and the right dosage for you.
Especially important if you have other health conditions, right? Or take medications.
Absolutely. Interactions are possible. Your doctor needs the full picture.
And it sounds like these vitamins work best as part of a team, teaming up with other healthy habits.
Definitely. Pair good nutrition with regular, gentle exercise, like those sunlight squats or knee lifts we mentioned. Movement helps your body actually use these nutrients effectively.
Makes sense.
And critically, don't ignore persistent symptoms.
Yeah.
If you have ongoing leg cramps, weakness, numbness, balance problems, don't just try to supplement it away. Discuss these with your healthcare provider to make sure there isn't some other underlying medical issue going on.
Good advice. And start small.
Yes. Small, consistent changes are almost always more effective and sustainable than trying to completely overhaul everything overnight. Be patient with yourself.
That's all incredibly helpful. So just to wrap things up, final thoughts.
I think the main message here is one of empowerment. You really do have a lot of power to support your leg health by understanding these key vitamins and making mindful choices. It's not just an inevitable decline with age.
It's about giving your body the raw materials it needs.
Exactly. The building blocks it needs to function well, to keep you steady and strong.
And it doesn't have to feel overwhelming. You can just start with one thing.
Please do. We really encourage you to pick just one small, actionable step today. Maybe it's making a conscious effort to get 10 minutes of sunlight. Maybe it's choosing a more nutrient-dense breakfast tomorrow.
Or maybe it's making that appointment to talk to your doctor about getting your vitamin levels checked or discussing supplements.
Any of those is a fantastic start.
And maybe a final thought for everyone listening. Consider that feeling of steadiness, of confidence in your steps when you walk. That's not just about having physically stronger legs, is it?
No, it's much bigger than that.
It's about reclaiming or holding on to a really vital part of your independence, your ability to engage with the world. So the question is, what small step will you take today to move closer to that feeling?
A powerful question to end on.
Thank you for taking this deep dive with us today.